Hello friends and welcome back to the channel. Today we have length of the pregnant uterine horn. It rotates on its longitudinal axis. If it rotates in the anti-clockwise direction, it is called the left side uterine torsion, while if it rotates in the clockwise direction, it is called right side uterine torsion. So now, as you can see in the picture, in the right side torsion, the ligament and the middle uterine artery, it is stretched and pulled vertically downwards under the uterus. Whereas, if it is stretched and pulled tightly across the top of the uterine body, as in the picture number 2, it is called the left side torsion. Right side torsion is more common than the left side torsion. Now, next is the position of uterine torsion. It can be post-cervical torsion or pre-cervical torsion depending upon the site of the twisting. If the twisting is towards the vaginal side, it is post-cervical torsion, whereas if it is towards the uterine body side, it is pre-cervical torsion. Hence, in post-cervical torsion, there is involvement of vagina, whereas in pre-cervical torsion, there is involvement of uterus. On per-vaginal examination, there is abrupt twisting of fingers towards right or left side depending upon the site of torsion in case of post-cervical torsion. And the cervix is not palpable if there is a torsion of more than 180 degrees. While in case of pre-cervical torsion, the external os can be easily felt, but fetus is not palpable. And the cervix, it is stretched towards the side of the torsion. This type of uterine torsion is more difficult to diagnose than the post-cervical torsion. Next comes the approach to correct torsion, which depends upon the following factors. Number 1, degree of torsion. More is the degree of torsion, more is the difficulty to correct the torsion. Next is the stage of gestation, and finally the condition of the dam and fetus. Now, if the fetus and its membrane, they also rotate with the uterus, will lead to compression of blood supply to the fetus, and which will cause hemorrhages and seepage of blood in the allantoic, which will finally lead to the death of the fetus in utero. And if the fetus is dead, then the correction of torsion becomes more difficult. Now, finally, we have come to the treatment of uterine torsion. Treatment of the uterine torsion or correction of the uterine torsion can be done by the following method. Number 1, manual detorsion per vaginally. Number 2, detorsion by simple rotation. Number 3, Schaeffer's method or modified rolling technique. This is the most common method for correction of uterine torsion. It is also called Planck method. Number 4, flank laparotomy. and finally with the cesarean section. So now we will be discussing a case study in which the uterine torsion in cattle was relieved using plank method or modified rolling technique. This was a case of left side torsion. Animal was showing sign of straining since 12 hours. On per rectal and per vaginal examination, it was confirmed to be a case of left side post-cervical torsion of around 180 degree. The animal was secured in the lateral recumbency with left side down. The uterus was fixed with the plank and the body of the animal was rotated in the anti-clockwise direction. Then it was checked per vaginally. It was still twisted. Hence, another rotation was given similar to the previous rotation. On per vaginal examination, the fetus limbs were felt and the animal parturated after half an hour successfully, as it is seen in the video. Thus, timely intervention saved 2 lives and the animal and the calf were perfectly normal post the procedure. Thank you for watching the video. Please subscribe to the channel for similar content and like and share this video with your friends.